Dr. Khan, this is a statement from a prominent German plastic surgeon. There is currently no sound, peer-reviewed evidence that capsulectomy is necessary for symptom relief in the absence of their other indications. There are no explantation experts. Research suggests that mental processes contribute to systemic symptoms and mental health issues should be addressed.
So this is a very interesting remark. If you look at the many patients who have successfully explanted, which means the entire implant and capsule is removed, and also those patients that have had residual capsules removed and they were very much hurting, and then they sought another plastic surgeon who removed the residual capsules and or the inflamed tissue, you will see directly from their symptomatic improvement in their many symptoms of what is suggestive of what is breast implant illness, along with, even if you just look at their faces, you will see the before and after significant improvement in their physiologic state. You can see the inflammation has improved. You can see their complaints with joint, back, neck, rheumatological problems, amongst the many other problems that the patients presented with have improved. So clearly, this is not a psychological phenomenon that the patients have gone through, and I find it insulting that this plastic surgeon would say it's all the stresses in the mind that are causing these patients' symptoms to go haywire. It is the implants. We have evidence from 1992 when the silicone implants were banned and the hurt and harm that they were causing. And we now see the same set of problems ever since the 2007 onwards in the United States. When the silicone implants were reintroduced, we have many patients who are coming forth with what is silicone toxicity, silicone within their lymph nodes, and many signs and symptoms, what is consistent and suggestive of what is breast implant illness. And clearly there is a direct cause and association between the implants. And as you will see right here, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. This is breast implant illness by definition. What else would you call this? And so it does exist because the manufacturers themselves look at their Mentor advertisement. One of the major breast implant manufacturers in the United States is telling you this. This is on their brochure, on their advertisement. And then they mention individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution, which means a cure of symptoms when the implants are removed without replacement. And we see from the subset of patients where the residual capsules were removed, these patients are certainly very much improving. And also, lastly, if you look at the many pathology reports, you will see within that capsule or tissue that is removed that there is chronic inflammation, histiocytic reaction, giant cell reaction, inflammation changes, inflammatory cells that are the underlying cause of this hurt. So there is a very clear direct association between the implants and the hurt that the patients are going through. All what we need to do is listen to the many patients and not to dismiss them. And unfortunately, this is what is happening. So if you listen to the patients, you will get all the answers. This is Dr. Khan, Executive Plastic Surgery.